Tissue flossing, or voodoo flossing, is a myofascial intervention which involves wrapping a latex band around a joint or muscle group, then performing various passive or active movements. This technique has been shown to improve range of motion as well as other metrics, which I'll get into later in this video. A simple rule of thumb to follow when flossing is 50% band tension with 50% overlap. Always look to wrap the band towards the heart and tuck the last bit of remaining band in. Once you have it on, work through a bunch of different movement patterns. Keep it on for a couple of minutes and use common sense. Any numbness or tingling, it's probably a good idea to take it off. This method was popularised by Kelly Starrett with the release of his Supple Leopard book back in 2013. To my knowledge, the responsible mechanisms behind the possible changes in range of motion and performance parameters still require further research. However, suggested mechanisms are related to fascial shearing or an increased reperfusion of blood following vascular occlusion. There have been several studies that have looked at flossing on a number of parameters such as performance, range of motion, pain reduction and recovery. In general, there's evidence that floss band treatment can increase the range of motion of the related joint, increase jump height, and flossing applied on the thigh can positively affect isometric strength. However, these findings only show small to moderate magnitudes in change. There is also conflicting research on the use of flossing for recovery. Some case studies and studies with small sample sizes reported a reduction in pain following a flossing treatment. However, more evidence and controlled studies are necessary to understand the effects of flossing interventions, especially for several weeks on pain and injury. Overall, there's a need to conduct longer-term studies on the use of flossing on different parameters. There also doesn't seem to be any clear best practices for the use of flossing, which is also a gap within the research. With all that said, what's my take on flossing? Now, I've been using the flossing band for years. I've experienced improvements in range of motion and pain reduction in my left knee. Now, whether that's based off any of the research that I've talked about earlier or whether it's a placebo effect, who cares? If you find that something benefits you, then it doesn't really matter. My advice is to try it yourself and make your own decision. If you feel it provides a benefit, then great, crack on. If not, leave it. Hopefully you found this video helpful. Would love to hear in the comments below what your thoughts are on flossing. Thanks for watching.